Assalamu alaikum wa rahmatullahi wa barakatuh, brothers and sisters. My name is Dr. Muhammad Tashani. I'm a medical doctor and a clinical researcher at the Children's Hospital at Westmead, and my specialty is about Hajj research. Now, for the last 4 years, I have been researching diseases at Hajj, and I have went personally to Umrah and Hajj several times, and I have accompanied Hajjaj several times, and I have treated them. So I gained some experiences in Hajj research and Hajj diseases. So I decided to make a small presentation to make an advice to the Hajj pilgrims who are going to Hajj in order to help them to maintain their health during their Hajj or Umrah. So بسم الله الرحمن الرحيم. ويقول الله تعالى في كتابه الكريم بسم الله في سورة الحج بسم الله الرحمن الرحيم يا أيها الناس اتقوا ربكم إن زلزلة الساعة شيء عظيم يوم ترونها تذهل كل مرضعة عما أرضعت وتضع كل ذات حمل حملها وترى الناس سكارى وما هم بسكارى ولكن عذاب الله شديد. So this is the first verse in the chapter of Hajj. Now scholars say why the first verse of the chapter of Hajj is not talking about Hajj, it's talking about Judgment Day. Now scholars say this is because Allah subhanahu wa ta'ala made Hajj one of the reasons or the concept of Hajj to remind us of Judgment Day. Judgment Day involves a lot of gathering and crowding, and this is similar situation in Hajj. There's a lot of mass gathering and pushing, crowding, coughing and sneezing everywhere, so there's a high risk of acquiring infectious disease from one person to another. So this is the introduction to my presentation today. So first, we need to ask ourselves one important question. Why do we need to take care of our health at Hajj? Of course, everyone wants to stay healthy, whether at Hajj or not. But there are certain reasons we want to stay healthy at Hajj, no matter how hard it takes, whether money or a lot of effort. We need to comply with these health recommendations, no matter how hard it takes. So why we need to do so? First of all, because we need to complete our pilgrimage or our Hajj. Now, I have personally been there before, and I have been sick, and I got disease called pneumonia. I was bedridden, and I couldn't move from the bed. Luckily, it was Umrah, not Hajj, so I didn't miss much. But if God forbid you get any of serious diseases at Hajj, you cannot complete your rituals, you miss one important day like Arafat, you lose your whole Hajj. So you want to stay healthy, no matter how hard this takes, so you can stay fit and maintain your health to complete your whole Hajj pilgrimage. And also you want to stay healthy because you not only want to protect yourself, but you also want to protect your family at home when you come back. So some people may not get disease, but they might acquire a state we call carriage state. So this means you might carry dangerous germs in your throat and your nose, and you import these diseases to your house. And when everybody starts congratulating you for Hajj, kissing you and hugging you, and you kiss your family, your daughters or sons, you may transfer this disease to them, especially if they are small children, they are vulnerable, they might get sick as well from you after Hajj. So general advice before and during Hajj, general advice regardless of the health advice. First of all, you need to carry an easy luggage, so and clearly labeled with wheels and telescopes, so you don't need to carry it on your back wherever you go. This is important because at Hajj you need to be a dynamic and very mobile person. You need to move from one person to another, from one hotel to another. So you don't need to carry a lot of bags on your back or carrying them on your hands. So you need to be very flexible and very movable person. So it's important that you carry all your luggages with with wheels and telescopic handle like this one in the picture here. Another important advice is you need to be aware that the electricity outlet there is different from the one that you have here in Australia. This is how it looks like. So it's important that you bring your power bank, your portable charger or international adapter with you, so you can these things will make your life much easier, especially these days. Nowadays everyone is using their smartphones for directions or to read the Quran or for adhkar or anything. So there are a lot of places there when you spend most of your time outside the hotel room, away from energy source, or you spend few days in the tents in Mina or in Muzdalifah and Arafat. There's no power source there, so you can take your own power bank or portable charger. This will make your life easier. Another important thing is you need to gradually increase your fitness before Hajj. This is like at least 1 month before Hajj, you need to start walking at least half an hour every couple of days, because most of the Hajj rituals or manasik involves a lot of walking. So you need to be prepared for this. Another advice is the airplane. You need to wear loose-fitting clothing and walk in the airplane. Why do you need to walk in the airplane? Because traveling at Hajj from Australia, it requires it's a long distance. It's like more than 10 or 12 hours of flying in the air, and you will be sitting all the way in the same place, and so that's a risk of something we call DVT. It's like or deep vein thrombosis. It's like a blood clot that can be formed in the back of your leg here in the calf muscle, and it's very dangerous. If that clot moves or dislodged from its place, it may cause something in the lung we call like thrombus, and the lung, like a heart attack in the lung, and it's very fatal, very dangerous one. So you need to reduce the risk of developing this deep vein thrombosis. So you need to do some stretch exercise. You need to walk or move. Keep your muscle or lower body moving in the airplane. At least one in every couple of hours, 1 hour or every couple of hours. Move in the airplane. Go to the bathroom. Come back. Move. Stretch your legs to keep the circulation going, to avoid any stagnation or blood clot in your calf muscle. This is very important, especially if you are diabetic, or you're suffering from heavy weight, obesity, or you are 50 years old or older. Another important advice is to take a photocopy of all your valuables, any passports, tickets, visas, everything. You need to take a photocopy of it, and it's important that you keep a soft copy in a Dropbox or email. So whatever happens, God forbid you lose everything or anything, at least you can retrieve a copy from your email or Dropbox. Now, one important advice to the pilgrims, brothers who suffer from chronic condition or multiple conditions, diabetes, heart problem, asthma, lung, nervous condition, anything that's a little bit complicated and they require a lot of medication, it's very highly recommended for them to seek their doctor's advice or the family doctor before they embark on their journey. And they ask him for recommendations or advice on what he can do in the emergency. And most importantly, you ask him for a report summarizing your condition and the medications that you are taking. So if God forbid any emergent, if you suffer from any urgent or serious condition there, it will be easy for you to communicate with the doctors in Saudi Arabia. You can just give them that report summarizing your conditions and your medications that you take. So it will be easier, especially if God forbid you lose your conscience or you be unconscious or in coma. At least that piece of paper, your tent mates or roommates, they can give that paper to doctors. They can know what you are suffering from. So it's also important that you tell your roommates about whatever condition that you have, whether you suffer from diabetes or heart issues or any chronic medical or serious illness. Now, what medications you can take with you at Hajj? You can take some disinfectants or alcohol gels or something to can wash your hand to keep your hands clean most of the time. You can take painkillers, fever medications, Panadol. That's very important. Flu medication, something we call decongestant to relieve the symptoms of cold and flu. You can take sunburn ointments. You can take painkillers for digestive and stomach pains. And importantly, you can take something we call oral dehydration salts for diarrhea. If you suffer from traveler's diarrhea, you get a lot of motions and diarrhea. You lose your body fluids, so you need to compensate that with this medication. Another thing you can take with you is some ointment or lubricant for skin rash or exfoliation or Vaseline, especially for the brothers who will be wearing the ihram clothing. There will be some friction between the inner aspect of the thighs. They will develop some ulcers or exfoliation. So it's important you rub your inner thighs with lubricant to reduce any friction. These are general advice before Hajj. So at Hajj, what are the risks at Hajj? At Hajj, there are some communicable diseases that can be transmitted either by air or by food or water or by blood. So let's start with communicable diseases that can be transmitted by air, which we call respiratory diseases. Now, these diseases include such as meningitis, influenza or influenza-like illness, pneumococcal pneumonia or pneumococcal diseases in general, or pertussis or whooping cough, And recently there's an emerging disease called Middle East Respiratory Syndrome coronavirus, or also known as coronavirus. Now, how we can, these diseases, the meningitis is a bacterial infection that causes serious inflammation or infection around the brain. It's very deadly. Influenza, we all know and heard of influenza virus that can cause you sick and give you the flu. Pneumococcal pneumonia, it's a bacterial infection, affects the lung, and it's very serious, especially if you are elderly. Pertussis whooping cough is a bacteria that causes a lot of cough at Hajj. And the last one, the coronavirus, is a virus that has been circulating and affecting the lung, and currently there's no specific treatment for it. So how can we prevent or protect ourselves? First and most important thing is to keep good proper hand hygiene. It's very important. This is how most of the respiratory diseases are transmitted, not through direct cough or sneeze, but mostly through by your hands. When you touch public surfaces, the doorknobs, or when you pray on the floor, touch public surfaces, and then you start touching your face or nose or scratching your eyes. This is how disease transmitted. So it's very important that you keep good hand hygiene. As soon as you enter your home, your hotel room, you wash up your hands, and keep your hands away from your face all the time. Make it a habit even now, even regardless of the Hajj status. And of course, as I said, avoid hand contacts with the face. Use disposable tissue if you need to cough and sneeze, and follow what we call cough etiquettes or manners. As you see in the picture, it's very wrong to cough in your hands, because eventually you need to shake someone else's hands, or to touch yourself with your hands. So the best thing is to cough in a disposable tissue, as you can see here. Or if you do not have a tissue, the next best thing is to cough in the upper arm, as you can see in this picture, or this one in the clothes. So at least when you cough in the upper arm, you're not coughing in your hands itself, and so you maintain a good hygiene for yourself. And of course, and most importantly, avoid sharing personal items such as towel or anything with anyone else there. When you go to the hotel room, most of the hotel rooms you'll be sharing with someone else. So try to designate your own towel and separate it from the others, and make it clear. Additional measures, preventative measures. We all know the vaccine. Now, meningococcal vaccine is mandatory. You cannot go and have a valid Hajj visa or even Umrah without a meningococcal vaccine. Influenza vaccine is also recommended, highly recommended. You need to take it, and it's also available everywhere. Pneumococcal vaccine is very important, but unfortunately is a little bit expensive. I think might cost more than $90 or $100, and fortunately it's available for free at in Australia local doctors if you are suffering from a chronic medical condition like diabetes or heart or lung or chronic serious illness, or if you are 65 years or older, you can receive this vaccine free of charge. Pertussis, also there's a vaccine against pertussis, and there are also vaccines against hepatitis B or hepatitis A or typhoid, and these are usually what we usually call our traveler's vaccine. If you visit any doctor, your family doctor, and you tell him he knows that you are traveling overseas, he will immediately recommend these ones. However, if he is really expert, or at least he has some background on Hajj, he will probably recommend these ones first, because these ones are transmitted through air. So the priority goes to this one first. If you had these, then you can have these ones, hepatitis B, A, and typhoid, because these are transmitted through food. And at Hajj, there's low risk from diseases transmitted through food, unlike diseases transmitted through air. So these ones will be priority. If you can still afford the other ones, then you can take them. Another preventative measure, we said the cough etiquettes, hand hygiene, the vaccine. The additional one is wearing the face mask. Now, wearing face mask, some might find it a little bit uncomfortable, but at least if you cannot wear it 24 hours, at least wear it in the most crowded places, especially during tawaf, at the haram, at the entries, at the exits, when you are in the elevator, when there's massive crowd, especially, and also when someone is around you that's sick, or you personally become sick, try to wear the face mask, and keep a face mask or plenty of face mask in your pocket wherever you go. Now, what are the guidelines for the face mask? First and most importantly, it must be the face mask and your hands must be clean before you use it. Now, the face mask has two surfaces. The upper surfaces could be bent around your nose, This is the hard one. The lower one is the soft one. And the very important advice, you need to change the face mask at least every 4 and 6 hours. You can't put on the same face mask for the whole Hajj duration. You need to change it whenever it becomes wet or damp or after 4 hours, 4 to 6 hours. And if you already became sick, as we said, you need to keep some social distancing between you and someone else. Try to cover your mouth and nose with a tissue or the face mask, or cough on the upper aspect of your arm, as we said. Take some enough sleep, vitamin C, lemonades, enough fluid, antibiotics and painkillers. And most important thing is try to avoid taking antibiotics. Now, we have conducted a research like 2 years ago, and we find most of the Hajj diseases that causes cough and fever mostly are virus. With virus, antibiotics do not help. Antibiotic does not kill a virus. So do not take antibiotics unless with the prescription from a doctor who can distinguish whether it's a virus or bacteria infection. And if he prescribes the antibiotics for 5 or 6 days, you need to complete the whole course of antibiotics, 5, 6, or 7 days. Do not just take them one pill or 2 pills 1 or 2 days and stop, because this will make the bacteria and germs in your throat more aggressive, and they get used to this antibiotic and develop resistance. So again, avoid antibiotics unless with doctor's prescription.
Coronavirus is the cause of the Middle Eastern Respiratory Syndrome. It's a virus we can all help prevent from spreading. Please take the following precautions to prevent infection. Wash your hands with soap and water, and use antibacterial gels regularly. Avoid touching your eyes, nose, or mouth as much as possible. Use a tissue when coughing or sneezing, and discard it in a wastebasket after use. Avoid contact with infected individuals, and use a face mask when doing so, and maintain general hygiene. For more information, please visit the Ministry of Health's website.
These were summary advice from recommendations and advices from the Ministry of Health Saudi Arabia. We thank them for it. Now we were talking about diseases that can be transmitted through air, and we know them some most common diseases and serious diseases, and how we can protect ourselves. Now, another type of diseases we call gastrointestinal diseases that can be transmitted through food and water, like travelers' diarrhea or food poisoning. How can we protect ourselves? Again, good personal and hand hygiene, as we mentioned before with the respiratory diseases, and try to avoid street vendors who sell food and exposed food in the street. Try to stick to the hotel food or the food that's provided by the Ministry of Hajj at Mina or Muzdalifah. It will become clean and covered. And the general rule for food, we call it, we say peel it, boil it, cook it, or forget it. Another advice is to have small regular meals. Follow the sunnah: third for food, third for liquid, third for air for your stomach. Don't fill your stomach, because there will be a lot of food there, but especially at the hotels. If you stuff your stomach, you'll feel very heavy and you cannot perform some of the manasik. You better have small amounts of food, so you can stay healthy and focus on your manasik and dua and prayers and everything. One important advice: try to avoid storing cooked food. If the food is cooked, try to avoid storing it unless in the fridge. Don't store it in the bus while moving from one city to another, because the weather there is very hot, and it will become very rotten quickly and become source of a food poisoning. Another important advice that I personally recommend for you is minimize the meals, especially at Mina and Muzdalifah. When you spend few nights and days outside the hotel in Mina and Muzdalifah, and the sanitation there and the toilets and sanitary services there is not very high quality, and you may need to wait in a long queue to just get your turn to go to the shower room or the bathroom. So please put this in your mind when you are at the Mina, spending your few days at Mina or Muzdalifah or Arafat. Try to minimize the food as much as you can. You need to focus on your prayers and your manasik. And of course, the heaviest meal you can have at the breakfast, lower amount of food during lunch, and much less during dinner. One important advice regarding camel milk and camel contact in general: the camel milk has been recently linked to coronavirus. So try to avoid camel milk, or at least boil it or pasteurize it before consuming the milk at Saudi Arabia.
Coronavirus, Middle East Respiratory Syndrome. Since the coronavirus can be transmitted to humans by infected camels, the following guidelines outline how to handle camels to avoid infection. Cook camel meat including liver well before consumption. Boil camel milk if not pasteurized before consumption. Avoid as much as you can close contacts to camels, especially sick camels, and camel body fluids or secretions. If you have any question, we are here to help. The Ministry of Health.
With regards to water, there's no high risk from infectious disease there at Hajj, but generally try to avoid drinking water from tap or unclean ice cubes, and water generally should be bottled or boiled. And the best thing, of course, is Zamzam. But whenever you drink Zamzam, you need to pay attention to this, especially if you are going for the first time. This is what the water container of Zamzam looks like at the Haram, whether at the Haram Makki or Haram Nabawi. You need to pay attention here. What's written here? This size says the new cups, and this one is for the used cups. So try to drink from the right to the left. Don't get confused and start drinking from the left ones. So these are the new ones. These are the used ones. Do not get confused here. The last type of diseases that could be transmitted from blood. We call bloodborne diseases like HIV, hepatitis B virus, hepatitis C virus, or Ebola virus. And luckily, these diseases are not very common there, although they are very serious. And the only route of transmission there probably is through shaving razors. Some people share, unfortunately, the shaving razors or go to street barbers and they cut and injure themselves. Try to avoid these street barbers, and of course, don't share any razors with anyone. And sometimes during the peak of the manasik, you have to go during Yawm al-Nahr, you have to shave your head, and I think everyone, the 3 millions will be shaving their heads almost the same day, and sometimes you need to wait for long queue until you get your turn into one of the licensed barbers there, and it may be more expensive. So as I said in the first of this lecture, you have to wait and be patient no matter how much it takes with the money or waiting time. So don't rush to go to one of these street barbers, because they might injure you, get yourself cut or hurt, you get bleedings, and you might acquire some serious infections. So wait in line, go to the licensed barbers and pay for it. Another type of classification of hazards at Hajj, we've been talking about communicable diseases that can be transmitted from one person to another. The last category is the diseases that are non-communicable or health conditions that are not transmitted, like the hot environment with hot weather. We know the weather there in Saudi Arabia is hot weather in winter or summer. So the most important thing is to have a good fluid intake and seek shade wherever possible. Take your umbrella with you, and white clothing for the sisters important. White clothing reflects heat, so do not absorb the sunlight or heat. And try, if you can, perform some of the manasik rituals at night. When you arrive there, try to ask your Hajj group leader, when is the non-peak hours, or what manasik can I perform at the nights. You can wear also sunglasses, sunblocks, sun cream, and wear white clothing, as we said. And the most important thing for the brothers, to put some Vaseline cream in once you are wearing the ihram, to avoid any friction between your legs. Special advice for the brothers or sisters who suffer from diabetes: they need to take extra care of their feet, because, as we said, most of the Hajj manasik involves a lot of walking, and they might suffer from injury and they do not feel it. So you need to take care of your feet. Bring your own shoes with you. Don't go there and buy new shoes, because new shoes will be very hard. So if you bring your own shoes, they will have soft straps. They will not cause any cut or injury. And you can put your shoes in the plastic bag like this one, and put it in another Hajj bag, so you can carry them wherever you go, so you don't lose them and you don't have to go bare feet to go back to your hotel room. Unfortunately, such conditions happen. If you suffer from these bullies or blisters from walking long distances, do not rupture it, because if you burst it or rupture it, it'll become exposed and you might get an infection. So try to rest, minimize your walking if you can, and put some ice and wrap it in a towel. The last risk at Hajj is the stampede, and we're still hearing some incidents of crowding and pushing stampede. And the most important thing here is whenever you go to any of the premises or a hotel room, try to locate the emergency exits and perform some rituals during non-peak hours. Ask your group leader, they are expert in knowing the non-peak hours. They know when is the less crowded times for tawaf or any other rituals. And try to follow the guidelines and your time schedule for your group for the manasik, like stoning or jamarat. And ask if you are sick or old enough, you can also ask your Hajj group leader about license or rukhsa. If you can delegate someone else to perform some manasik for you, like some stoning or jamarat, you can assign or designate some other person who can perform this ritual on your behalf if you are sick enough. So you can always consult your Hajj group leader about advices to avoid stampede and crowding and pushing. And also you might not spend the night in Muzdalifah. You can consult your group leader if you want to leave early. So there are always something. Allah Subhanahu wa Taala made some rukhas for you to ease the rituals and manasik. Finally, I would like to remind you, this is the ambulance service number 997. At Saudi Arabia, it works, but unfortunately cannot reach certain locations during the big Hajj. There's some at mass gatherings. It's hard for ambulance to reach you wherever you go. So it's very, very, very crucial that anyone who suffers from urgent conditions like heart or epilepsy or diabetes, keep your urgent medication with your pocket wherever you go. Even if you are wearing the ihram, put it in the belt. And the belt, so whenever you go, whenever you suffer from any urgent condition, someone else can help you. And of course, the hospitals and primary healthcare centers are free at Hajj. Now, summary of personal items you need to take with you wherever you go. Personal tissues, as we said, for coughing and sneezing, and if not available, you can cough in the upper arm. Do not cough in your hands, and keep your hands away from your face all the time. That's very important. You can also take a bunch of face masks, keep them in your pocket, and use them regularly and change them. Your emergency medication pills, as I said, you have to be accompanying with you wherever you go, and the plastic bag to keep to put your shoes on. After Hajj, inshallah, once you come back, Allah accept your Hajj and you come back healthy, have a good rest before welcoming guests. And if you are sick, try to avoid spreading disease to others. Do not spread disease to others, and cover your mouth and keep some social distances. Now let's summarize everything again.
In order to protect yourself from food poisoning, please do the following. Wash fruits and vegetables well before eating them. Always make sure canned foods are not past their expiration date. Avoid buying food from itinerant sellers. Do not eat food that is exposed to insects. Wash your hands before and after eating or preparing food. Avoid keeping cooked food at room temperature for more than 2 hours, as this may lead to food poisoning. For more information, contact us through the following channels. Hajj Health Awareness Program. Better health means better Hajj. Please do the following to protect yourself from heat strokes. Drink adequate fluids. Wear loose-fitting, light-colored clothes. Avoid long exposure to sunlight. Use an umbrella. Don't stress the body with excessive physical effort. Take adequate rest. Visit the nearest health facility when required. For more information, contact us through the following channels. Better health means better Hajj. If you have any chronic disease, please do the following. Consult your doctor in order to evaluate your physical condition and determine if you are capable of performing the Hajjah. Take a sufficient supply of medicines and keep them in a safe manner. Abide by the doctor's instructions, such as taking medicines at the correct time and following the diet recommended by the doctor. Wear a wrist bracelet or carry a card which shows your name, age, the type of disease from which you suffer, and the treatment required. Tell your Hajj tour doctor and the people accompanying you about your disease so you can get help when you need it. Avoid exerting much physical effort and make use of the legal allowances when conditions are right for them. Visit the nearest health facility when you don't feel well. For more information, contact us through the following channels. Better health means better Hajj. In order to limit the transmission of infectious diseases, such as hepatitis B and C, when cutting or shaving hair, please abide by the following. Use disposable single razors. Do not share razor handles. Handles are frequently used for different customers after changing the blades. Do not share your shaving tools with others. Keep away from street and sidewalk barbers. Compliments of the Ministry of Health. For more information, contact us through the following channels. Better health means better Hajj. For our brothers and sisters performing Hajj or Umrah, to limit the transmission of respiratory infections, including the coronavirus, please do the following. Wash your hands with water and soap on a regular basis. Use tissues when you sneeze or cough and dispose of them in the wastebasket. If tissues are not available, use the upper part of the arm. Use face masks in crowded areas and wash your hands after removing them. Avoid touching your eyes or nose with your hands. Avoid direct contact with infected persons. Wear a face mask when you deal with them, and do not share personal items with them. For more information, contact us through the following channels. Better health means better Hajj.
So thank you for listening. Make dua for us, please. And if you have any questions, here's my email. And you can also post any questions at the comments below. And inshallah, I'll respond to you. Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh.